There are many names used to describe pain on the outside part of the hip, which can make things a little bit confusing. Trochanteric bursitis, greater trochanteric pain syndrome, and gluteal tendinopathy. In this video, we'll talk about gluteal tendinopathy, some exercise progressions that can be helpful, and hopefully provide a little bit of clarity on what's causing the pain on the outside part of the hip. Gluteal tendinopathy is really just a fancy term used to describe tendon pain. Tendonitis was a term that we used to use when we thought that the mechanism was inflammatory driven, but it turns out that it's not actually an inflammatory condition, which is why we use the term tendinopathy. Instead of inflammation, tendinopathy is thought to be an overload condition, meaning that the loads placed on the tendon have exceeded what it can tolerate, leading to the pain. And there are two types of load that you should be aware of. The first is tensile loading, which is what we normally think of when we're loading a muscle or a tendon. And so if this is our tendon or muscle here, the loads would be going parallel to the actual structure, so they'd be going through like that. The other type of load is compressive loading, and so that's actually where the loads are going to be perpendicular to the structure. So if this is our muscle or tendon here, the loads would be going that way where there's a compressive load on the tendon. And compressive loads seem to be an important factor for gluteal tendinopathy, and that's because as the leg moves towards midline, it increases the compressive loads on the tendon against the greater trochanter, which is part of the leg. Which is why sitting with your legs crossed, doing a hip stretch, or sleeping on your side can be provocative because they're just increasing those compressive loads. Now, it's important to know that these compressive loads aren't actually dangerous to the tendon. They're not going to cause any damage to the tendon. They're just irritating positions because of those compressive loads. So why are we talking about the gluteal tendon and not the bursa? Well, it turns out the majority of the cases of pain on the outside part of the hip are actually attributed to a gluteal tendinopathy and not irritation of the bursa. In fact, there's actually some people that don't actually have a bursa, so it's actually hard to attribute the pain on the outside part of the hip if the bursa is not actually there. While it might seem kind of irrelevant what we call pain on the outside part of the hip, it's actually pretty impactful in how we treat it. If we think that there's inflammation of the bursa or inflammation of the tendon for that matter, then an anti-inflammatory treatment approach makes sense because we're trying to decrease that inflammation. So we might have some anti-inflammatory medications or opt for a corticosteroid injection. And this study here did find that corticosteroid injections did provide some short-term pain relief. However, it didn't last into the long term, whereas exercise provided the same amount of short-term pain relief and actually extended into the longer term. So exercise seems to be a better option for the long-term pain relief. And corticosteroid injections have been shown to have some negative effects on the tendon, including increasing the risk of a tendon injury. Finally, let's get into some exercises that can be helpful with gluteal tendinopathy. Generally, the rehab program is broken up into 3 different phases: isometric, concentric, eccentric, and then plyometric exercises. And it's not important that we actually perform them all in order. It really depends on what the person's tolerance is to loading. So for some people, they might have to start at some isometric exercises, while some might actually be able to start at a concentric, eccentric muscle contraction. An isometric contraction is where the muscle contracts, but the joint actually doesn't move. And these can be beneficial because they give us the most control over the position and the amount of load that we're loading that gluteal tendon. An example would be a side plank with the affected side down. We can start with the side plank on our knees, which will decrease the lever, which will also decrease the amount of load on that gluteal tendon. We want to try to lift our hips up off the ground as high as we can, which will help to minimize those compressive loads. We can then progress this exercise to a side plank on our feet, which just extends the lever, making this exercise a little bit more challenging. Generally, when we're performing these isometric contractions, we want to hold them for about 30 to 45 seconds and then repeat for 3 to 5 repetitions. Another option is to use an exercise band for a little bit of resistance. This time the affected side is going to be on the top. Rotate the leg and then hold this position. The benefit of this exercise is that it really avoids those compressive loads, so if somebody is really sensitive to compressive loading, then this might be a better tolerable exercise. The next progression is concentric and eccentric loading, which just means that while the muscle is contracting, we're going to be moving the joint now. For majority of cases, we can actually start at this stage. When we're performing these concentric and eccentric muscle contractions, we want to perform them slowly over 6 to 8 seconds for each rep. This allows the tendon to adapt to the loads that are being placed on it. If we perform them too quickly, we might not get the adaptations that we want. When we actually look at the structure of the tendon, generally heavier loads provide better stimulus to the tendon and helps to change the structure. Although when we look at pain, we don't necessarily need to load quite as heavy. The first exercise is actually a progression of the exercise that we just previously did, but instead of lifting the leg up and holding, we're going to slowly lift that leg up over 3 to 4 seconds and then slowly back down to that original starting position. Something to be aware of is that sometimes when we do this exercise, we have a tendency to rotate our whole body so the pelvis actually rotates backwards. There's nothing wrong with this. It just means that instead of actually lifting through the hip, we're actually moving through the pelvis. So it's just something to be aware of. And if we're trying to isolate the hip, try to keep the pelvis still and just rotate through the actual hip. We can then increase the lever of this exercise by using an exercise band around the ankles and then slowly lifting the leg up as high as we can go and then slowly back down to that original starting position. If it's more comfortable, we can also perform this in a standing position. So again, using the exercise band around the ankle and either using a furniture slider or a towel on some hardwood and then slowly extend the leg out to our side and then back to that original starting position. It's nice to use a furniture slider or a towel initially because it's a long contraction because it's over 6 to 8 seconds. So to decrease some of the stability and the balance that's needed, using a furniture slider can be helpful just so you can focus on the actual movement. But eventually actually lifting the leg up and taking a step nice and slow out towards the side and then back in is ideally where we'd want to progress to. A couple of other exercises that can be helpful include a hip airplane, a kettlebell pass-off, and a single leg deadlift. For the hip airplane, the focus is on rotating through the hip in a single leg position. I like to think that the shoulders and the hips are glued together so that they're rotating at the same time when we perform these. The kettlebell pass-off is a similar exercise, just with a little bit of load. The goal is to pass the weight from side to side without moving at the hip or the pelvis. The more your torso is parallel to the ground, the more challenging this exercise will be. And then finally, the single leg deadlift increases the load and increases the movement at the hip. So the goal with this exercise is that all the movement is coming from the hip, both the low back and all the other joints are still as we just pivot around that hip with a little bit of load. Last in the exercise progression are plyometric exercises, which help to expose the tendon to quicker loads and to prepare us for return to sport. A lateral lunge is one exercise that can be performed here. The goal is to think of it like a spring, so absorb the landing and then spring back to that starting position. Another example is a single leg hop. In this position, the glute has to control the pelvis on impact, which is similar to the demands during running. And then finally, these can be progressed to a skater hop, which just further increases the load on the glutes. So hopefully this video on gluteal tendinopathy helped to provide a little bit of clarity on pain on the outside part of the hip. If it did, go ahead and give this video a big thumbs up, and don't forget to subscribe to the channel.